Hi everybody, welcome to our Facebook Live this evening. This is a joint Facebook Live between Leukemia Care and Lymphoma Action. And today we are here to share some blood cancer patient experiences of the COVID-19 vaccine. Just to make it clear from the outset, we are not going to discuss anything sort of related to the science or the safety or any of those sorts of questions about the vaccine tonight. This is purely just a chat with people who have had the vaccine, and we're going to find out how it was for them and why it was important for them to have the vaccine. So if you have those sorts of questions, we happen to be having a webinar tomorrow afternoon with haematologists, and you are more than welcome to join that. I believe we're almost full, so quick as you can if you want to join that one. We'll put the link in the comments in a few moments' time, and I will mention it again before the end of the chat. Now to bring our guests in, thank you everyone for giving up 10-15 minutes of your evening. Not that we really have anywhere else to be at the moment, I guess. Yeah, so quick introductions. I suppose I should start with myself. I'm Charlotte. I'm the Patient Advocacy Manager at Leukemia Care, and you may have seen me on webinars and podcasts in the past for Leukemia Care. Tonight I'm joined by David, Emma and Tom. Tom, did you want to start and introduce yourself for me?
I'm Tom, I'm 21. I was diagnosed with acute lymphoblastic leukemia just over 2 years ago now. I'm currently studying at Manchester Uni to be a doctor.
Cool, thank you, Tom. Emma?
Hi there, my name's Emma. I'm 25 years old. I was diagnosed with chronic myeloid leukemia 4 or 5 years ago now. Ended up having a stem cell transplant, and I'm still on treatment with a TKI called ponatinib.
Cool, thanks Emma. And last but certainly not least, David, do you want to say hi to everyone for me?
Yeah, hi, I'm David. I'm 60 years old, living in the West Country. I have non-Hodgkin diffuse large B-cell lymphoma. I'm currently off work because I really just finished my treatment.
Great, thank you, David, for that. So like I said, we're here tonight to talk to these 3 people because they've all had 1 or 2 doses of the vaccine already. Obviously, COVID's been a little bit of a difficult time, particularly for blood cancer patients with shielding and things like that. So I guess what I wanted to start with you guys is sort of how has COVID been for you? I don't know whether, David, this time you want to start for me. Just what's the whole period been like for you?
Very difficult, really, because started my chemo in March, and really I had the first session. Then from afterwards, I couldn't have anyone join me, come in with me, and that included radiotherapy. So all the way through, basically had to do it on my own, which you cope, but it's very difficult. That's all I can say.
Yeah, and I guess you've being on active treatment is even more, not to belittle others' experiences, of course, but it must be even harder for you worrying about the fact you're on active treatment at the same time as everything else going on.
Well, the one good thing I would say was they were very good at the hospital. They moved the chemotherapy day centre to a completely different part, which made me feel a lot safer. But it's still a lonely experience, especially mine took about 7 to 8 hours each time. So wasn't the greatest experience of my life. Yeah,
no, I can imagine. What about you, Emma? How's it been for you?
Yeah, so I've been in a sort of a major molecular remission for quite some time. So I was pretty much living life as normal. And then all of a sudden to get sort of the shielding letter and being called vulnerable was a bit, it wasn't completely shocking, but at the same time, I agree with what David says, it has been lonely. And I just literally started a new job working in general practice. And then to come away from that so soon was disappointing. And yeah.
Yeah. And Tom, do you feel the same as Emma in terms of the vulnerable thing, being told you were vulnerable again? Is that something you can relate to?
Yeah, I feel like it took quite a few weeks to process. I've been on my medication. I know I'm more susceptible to viruses and stuff like that from my maintenance treatment, but it just took a couple of weeks to process. You almost felt like you'd gone back to square one at times.
Yeah.
Which is, it's weird to say, and it seems like you're being a bit dramatic, but it really did, because you go from getting your life back to normal again to not seeing anyone. And it's just like when you were in your main treatment phase.
And have you all been shielding as well? Like, do you consider yourself to be shielding? I mean, there's been a little bit of confusion as to what shielding is at various points, but do you all feel like you've been under those rules? I don't know. What about you, David? Someone's been on treatment.
I would say at the very beginning, I felt apprehensive about everything. I just overanalyzed every situation. Maybe if I had gone out, I would think, did I get too close to somebody? And then I could feel my face sort of going red with thinking about all of these different things. So at the beginning, then I've sort of settled into it more. I've got myself into a routine. I know what I'm doing. I stay away from people. I've even got to the point, if I was talking to somebody, I could tell you which way the wind was blowing. And if I felt it was in the wrong direction, I start moving myself around so that I was upwind.
Yeah, I'm sure that's something a lot of people who have been shielding and blood cancer patients can relate to. What about you other two? Have you been trying to follow these rules as best you can?
At the start, yeah, because I think the way the media portrayed it, it was almost as if you had any other health condition and you got coronavirus, you were in trouble. And I don't think it was very helpful at all. But I think as time moved on and you started seeing more and more come out, I think with my age, I'm pretty fit and healthy. I can go for runs and go to the gym. I started to think it's not worth locking myself away for the mental damage it was causing me.
Okay.
So I did start seeing a few friends again, and I've had to go into uni to do practical classes because otherwise I probably won't pass the year.
Well, I'm sure that's something other people will understand. It's not always possible to do everything that's advised, is it? No. How about you, Emma?
Yeah, I agree with what Tom said. So at the start of the pandemic, there was a lot of unknowns. We know a lot more about the virus now, and there was a lot of anxiety at the beginning of the pandemic about whether, you've got this or that condition, whether you should be shielding. And at the beginning of the pandemic, I took the decision to shield because the type of treatment I'm on, it's still a leukemia classed on active treatment. So yes, and now that I have had the vaccine, I'm still going to be careful the time being, but for the moment, I am still shielding.
Yeah, we'll come back to that in a moment, I think, because that's an interesting thought. Has anybody been personally affected by COVID? Have you had a positive test or anything like that? No.
My mum and dad did an antibody test back in November, and they all had antibodies. And the only time they'd been ill was back in March, and I'd actually sat next to both of them, watching a film with them the night before they got. So I must have had it and just been asymptomatic, because I don't see how I wouldn't have got it if I'm sat next to them and I've been with them for the 3 or 4 days before they got symptoms.
Oh, that's fortunate. What about you, David?
No, the only experience I have of it is actually where my granddaughter goes to nursery. They've just had two cases there. So that's the only sort of contact I've had, or near, experience of it. Other than that, no.
It's good to hear you've all been managing to keep yourself safe anyway. I guess then the next question is, why did you all feel it was important to get the vaccine? And then you get this text, I don't know how you got it, a text or an email or a letter or whatever, however it came through. What made you think, this is what I need to do next? I don't know. Emma, do you want to start first?
Obviously, my initial thoughts were getting this vaccine is going to prevent me having any serious, or hopefully prevent any serious complications if I was to get COVID.
Yeah.
And I sort of think that this is the first few steps that we need to take to sort of get back to some sort of normality. So yeah, those are the main reasons really why I decided to get it.
everybody feel the same way, Tom?
Yeah, mine was pretty much the same. I felt that I wanted to protect myself. For me, mine was slightly different because I can't go to work because I work in a care home, which is not the right place for me to be at the moment. But my name was still on the list. My company is still obviously employing me, so I was lucky enough to have the opportunity to go forward. I did at the time. I was quite apprehensive because it was around about, I think it was the 19th of December I actually got it, but it was about 2 weeks before that I was offered it. And I did phone up the Macmillan nurse at the hospital who's connected to my consultant and asked the question there. And the consultant come back and said, because I was post 3 months of chemotherapy, he was more than happy for me to go ahead. So that's what made my decision in the end.
That's a good message. If you're not sure, it's always worth a quick phone call to check. Yeah, no, that's good. What about you, Tom? What was your first thoughts when you got that message?
I was over the moon, I'm going to be honest. I just want to get back to normal. I feel like I'm losing some of the best years of my life in a sort of selfish way. I don't want to sound selfish, but I do feel like I've been locked away for 18 to 21 at times. And I've got exams to do. I need to get stuff done. I'm paying a lot of money to do my uni course. So it was just a massive relief that I can go in. I've got the mask and everything, so I'll obviously have all that on, but I can just feel a lot safer doing everything and not as high risk. Yeah.
I guess for you were ill not that long ago, and it was through a period where most people associate it with partying and having a bit of fun. So yeah, I can imagine you're keen to get back to that, definitely. What about concerns? Were any of you like any sort of concerns or second thoughts or anything like that?
Not really. I just thought that there's the right people who are doing all the research into it, and I felt quite confident about it. So I thought it was a no-brainer, to be honest, as long as I got the go-ahead.
Yeah, it's always nice to have that check with the haematologist just to be double sure. What about you, Emma? Any thoughts went through your head? Any concerns?
Yeah, just whether the sort of treatment that I'm on at the moment, whether the vaccine would be appropriate for me, because obviously there's lots of different types of leukemias and sort of different stages of treatment, and I just wanted sort of confirmation and reassurance from my specialist haematology team that they were happy for me to have it. So I rang them up, spoke to a specialist nurse that was really helpful, and she sort of went away and spoke to a couple of pharmacists and consultants, and then got back in touch with me and said, yeah, we've got the go ahead, you can have it if you've been offered it.
Yeah, and that's the overall message for everyone. I think if you are offered it, take it up. Feel free to double check with the haematologist, but as a general rule, it is safe for everyone to take it up. Tom, I think I know the answer to yours based on the response to the previous question I asked. But did you have any concerns at all when you were offered it?
Not at all. No, I just wanted to get there and get it done. I'd spoke to the doctor a couple weeks earlier, maybe. I'd gone in for bloods and just said, are you offering the vaccine at the hospital? And he said, no, you'll hear from your GP. So as soon as you hear from them, just go and get it. And that reassured me that it was all fine. And I've been reading about it all the way through the pandemic, and I knew it wouldn't be a problem if I went and got it.
Yeah, that's good. And did you all feel safe when you were there and having it? So what was the process, I guess? It might be different for all of you, but I think it'd be interesting to hear what the different processes were. Emma, how was it for you? Did you go to GP, or where did you get it done?
So, like David, I got offered it through my employer, and even though I was shielding at home, they still offered it to me, and I took it up. But the actual process itself was quite positive. I arrived at a particular time slot, so loads of other people weren't going to be there. Everyone, was following the social distancing measures. Everyone was wearing appropriate PPE. There was a nurse there checking for any, allergies or any reasons you know, any other concerns regarding having the vaccine. And then the actual vaccine itself was just like any other vaccine I've ever had. And then, yeah, it was fine.
Yeah, I shouldn't imagine it was too different to many other vaccines. If everybody's had the annual flu jab, it will probably be very similar. What about you, Tom? Was it any different?
They did temperature checks, took your name. They took our email and they said they'd send us an email afterwards to confirm we'd had it, which just gives you a bit of, you know, you've got something there to prove it. And then they made us wait around for 15 minutes afterwards just to make sure we didn't have any side effects or anything, and then they let us go. But everyone had masks on, everything was really safe.
Yeah, that's good to hear. Same for you, David?
Yeah, pretty much the same. Allocated slot, turned up, filled a small form out, went through, and it was actually triaged by a doctor who actually asked you the different questions. Did you have any allergies? And once he'd gone through that, he signed a form off. You had the vaccine, 15-minute sit down, and then you could go. I also got a little card as well with the actual Pfizer batch number and so on there, and then a return date. Obviously, that's changed slightly.
Great. That's good to hear. I have seen lots of people posting those little pictures on social media, which I think is quite a nice little trend. Everybody got their little badge to say they've had it. It's very cute. Coming to some of the final questions, I guess, one of the things I wanted to ask you guys about is sort of some misinformation. I don't know if any of you have seen anything going around, and does it worry you that there's potential for misinformation to go around about the vaccine? It's a difficult question.
Yeah, I think, which I think is completely normal for people to have a few concerns about this, is how quick the vaccine actually got developed and got sort of processed and authorized to be used. And I think how quick that happened, and, you know, it's normal to be concerned about that, but actually a little bit of reading around the subjects and sort of what a vaccine trial has to go through, it sort of passed all the other all the trials that it needed to get to where we are today. So yeah,
that's a good point. If anybody wants more information on, you know, the process and things, webinar tomorrow, we'll have all those details. Thanks for bringing that up, Emma. That's really important. What about you, David? Did you see anything?
I did exactly the same thing, did a bit of reading around it, and they went through the same processes as any other vaccine. There was no corners cut as far as I could see. And it may be, the way I see it, with the way they're engineering these vaccines, they might even come out quicker, because some of it looks like they just sort of have a base thing that they do, and then they just need to tweak a few bits. So you may find that things will get even quicker anyway.
That's interesting. I'd not seen that, but I think it's been an amazing time for science. I think it's all very fascinating if you're into that kind of thing like I am. Very interesting times indeed. What about you, Tom? Anything that particularly concerns you that you want to sort of try and reassure people about?
I mean, the way I'd seen it put on Twitter, this is from a doctor who worked with vaccines, and he just said it's like if one person painted your house, it might take a few weeks, but if 1,000 people painted your house, it's only going to take a day. And that's what happened with the vaccine. You had the whole world working together with lots of money and lots of volunteers, whereas normally you've got funding issues, ethical issues, loopholes to jump through, whereas that was all made a lot easier.
Yeah, no, that's absolutely true. I like that metaphor. A lot of those good things going around on Twitter at the moment. I wanted to finish on sort of a nice thing. I want to make this clear before I ask this question. Obviously, once you have the vaccine, there is no change to the rules at the moment. The advice is to continue to shield and continue to follow all the social distancing guidelines. But I did want to ask, what one thing are you all looking forward to once the pandemic is over, when we're allowed to sort of do a bit different things? What's your big hope now you've had the vaccine?
I would like to visit my mother, who lives in Tenerife. She's 94, lives on her own, and that's the one thing I would like to do.
That's really nice. Hopefully soon, David, hopefully. What about your other two? Anything in particular looking forward to?
I want to go back to the football. We've got season tickets at Man City, and we've not been able to go, and it's been horrible. We normally go with my dad and my brother, so it's normally quite a nice thing to do, sort of once every couple of weeks.
More of a rugby girl myself, but I agree. I'd like to get back into the stadium and enjoy it. Yeah, that's that kind of thing. What about you, Emma? What are you looking forward to?
I think just getting together with friends and going out for a nice meal and some drinks, and then going on a nice night out. That's what I'm most looking forward to.
Yeah, I do miss just chilling out in a bar or something like that. That would be lovely.
And sports with real people as well. That would be great. Proper crowds at sports. It's just not the same.
It's not at all.
Definitely. Well, thank you guys for that really interesting conversation. I really appreciate you giving up 20 minutes of your time this evening. And I hope everybody has found that really, really interesting to listen to. Some great messages in there. If you're not sure, speak to your doctor. But overall, have the vaccine if you're offered it. It should hopefully get us out of this crazy time very, very soon. Thank you, guys. And I guess the last thing for you to mention is that webinar again. So tomorrow at 2 p.m, I believe, if I've not got that wrong, I hope I haven't got that wrong. It's a joint webinar between Leukemia Care and Lymphoma Action. We'll have a few haematologists, someone from the MHRA to talk about sort of the process and the licensing and things. So if Emma's comment intrigued you, do come along and listen to that. I hope you all find it useful. Have a lovely evening, everyone. And thank you again to our speakers. Thanks, guys.